in this video we will discuss about a very important topic, that is depression. And the topics which we will cover in this video are: what is depression, what are the symptoms, what are the signs and symptoms, that is the clinical features of depression, what are the causes of depression, what are the types of depression, that is what is major depressive disorder, what is persistent depression disorder, next what is bipolar depression, then what is depression and anxiety, and next depression and obsessive-compulsive disorder, that is OCD. And then we'll discuss about the depression with psychosis, and we will also discuss how depression affect in pregnancy, and then we will discuss about depression and alcohol. And after that we will discuss about the investigations that one can do for depression, that is we will talk about the depression test. So these are the basic topics which we will cover in this video. So let's start. So first of all, we'll talk about what is depression. So depression is classified as a mood disorder. It may be described as a feeling of sadness, loss, or anger that interferes with a person's everyday activities. People experience this depression in different ways. It may interfere with their daily work, resulting in lost time and lower productivity. It can also influence relationships and some chronic health conditions. And conditions that can affect births due to depression include arthritis, asthma, CVS, that is cardiovascular disease, cancer, diabetes, obesity. So these are some diseases which are associated with depression. So this was all about the exact meaning of depression. Now next we'll talk about what are the clinical features, that what are the signs and symptoms of depression. So let's talk about that. So depression can be more than a constant state of sadness or feeling blue. And major depression can cause a variety of syndrome or symptoms, and some affect your mood also, and other affects your body. Symptoms may also be ongoing or come and go. The symptoms of depression can be experienced differently among men, women, and children differently. And men may experience symptoms related to their first mood, such as anger, aggressiveness, irritability, anxiousness, and restlessness. Secondly, emotional well-being, such as feeling empty, sad, and hopeless. Next, behavior, such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, engaging in high-risk activities. And next, such as inability to concentrate, difficulty completing tasks, delayed responses during conversations. Next, sleep patterns such as insomnia, restless sleep, excessive sleepiness, not sleeping throughout the night. Next, physical well-being such as fatigue, pains, headache, digestive problems. Now let's talk about the women. So women may experience symptoms to their mood such as irritability, emotional well-being such as feeling being sad or empty, anxious, and hopeless. Next, behavior such as loss of interest in activities, withdrawing from social engagements, thoughts of suicide. Next, cognitive abilities such as thinking or talking more slowly. Next, sleep patterns such as difficulty sleeping through the night, waking early, sleeping too much. Physical well-being such as decreased energy, greater fatigue, change in appetite, weight changes, aches, pains, headaches, and increased cramps. So now next, let's talk about the children's, what symptoms they can feel and what you can observe. Now children may experience symptoms related to their mood such as irritability, anger, mood swings, and crying. Next, emotional well-being such as feeling of incomplete. For example, I cannot do anything right. Or despair or crying, intense sadness. Next, behavior such as getting into trouble at school or refusing to go to the school. Avoiding friends or siblings, thoughts of death and suicide. Next, cognitive abilities such as difficulty concentrating, decline in school performances, changes in the grades. Next, sleep patterns such as difficulty sleeping too much. Next, physical well-being such as loss of energy, digestive problems, changes in appetite, weight loss or weight gain. So these are some signs and symptoms that you can face if you are suffering from depression. We'll discuss about the etiology, that is, what are the basic causes that leads to depression. This is very important here, that what is the basic cause behind depression. So there are several possible causes of depression. They can range from biological to circumstantial. So some common causes include, first, family history. You are a higher risk of developing depression if you have a family history of depression and another mood disorders. Secondly, early childhood trauma. Some events affect the way your body reacts to fear and stressful conditions or situations. Third, brain structure. There is a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happened before or after the onset of depressive symptoms. Next, medical conditions. Certain conditions may put you at a high risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder, that is ADHD. Next, drug use. A history of drug or alcohol misuse can affect your risk. So these are some causes behind depression. Now next we'll discuss about the types of depression. So there are various types of depression. So observe them carefully. So as we all know that depression can be broken into categories depending on the severity of the symptoms. Some people experience mild and temporary episodes, while others experience severe and ongoing depressive episodes. There are two major types especially. First one is major depressive disorder and second one is persistent depressive disorder. These are the chief types of depression. There are also some another types of depression that we will also discuss later on. So first of all, we'll talk about major depressive disorder. What is major depressive disorder now? So it is the more severe form of depression. It is characterized by persistent feeling of sadness, hopelessness, and worthlessness that doesn't go away on their own. In order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a 2-week period. And the symptoms include feeling depressed most of the day. Second, loss of interest in most regular activities. Third, significant weight loss or gain. Next, sleeping a lot or not being able to sleep. Next, slow thinking or movement. Next, fatigue or low energy most days. Next, feeling of worthlessness or guilt. Next, loss of concentration or indecisiveness. And the last one is recurring thoughts of death or suicide. So these are some symptoms which can be faced if you are suffering from this type of depression, that is major depressive disorder. What is persistent depressive disorder now? So PDD, that is persistent depressive disorder, it is a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. Persistent depressive disorder can affect your life more than major depression because it lasts for a longer period. And it's common for people with PDD too. First, now let's talk about the symptoms of persistent depressive disorder. So they are lost interest in normal daily activities. Second, feel hopeless. Third, lack productivity. Last, have low self-esteem. So this was all about persistent depressive disorder. Now third type of depression is bipolar depression. So let's talk about it. So bipolar depression occurs in certain types of bipolar disorders when the person experiences a depressive episodes. People with bipolar disorder may experience significant mood swings. Episodes in bipolar 2, for instance, typically ranges from maniac episodes of high energy to depressive episodes of low energy. This depends on the type of bipolar disorder you have. A diagnosis of bipolar 1 have only the presence of maniac episodes, not depression. And some of this depression in people with bipolar disorder may include these symptoms. Now let's talk about the symptoms which are faced by the person who are suffering from bipolar depression. So they are: first, loss of interest or enjoyment for normal activities. Second, feeling sad, worried, anxious, or empty. Third, not having energy or struggling to complete tasks. Fourth, difficulty with recall or memory, or you can say dementia. Fifth, sleeping too much or insomnia. Sixth, weight gain or weight loss as a result of increased or decreased appetite. And the last one is contemplating death or suicide. So this was all about bipolar depression. Now next is depression with anxiety. Now let's talk about it. So depression and anxiety can occur in person at the same time. In fact, researches have shown that over 70% of the people with depressive disorder also have symptoms of anxiety. Depression and anxiety produce several similar symptoms which can include irritability. Second, difficulty with memory or concentration. Third, sleep problems. And the two conditions also share some common treatment. Both anxiety and depression can be treated with by using medications that we will talk on later on. Now next. Another type of depression is depression and obsessive-compulsive disorder, that is OCD. And it is a very dangerous type of depression. Now let's talk about it, that what is OCD. So, obsessive-compulsive disorder is a type of anxiety disorder. It causes unwanted and repeated thoughts, urges, and fears. Fears are basically called obsessions. These fears cause you to act out repeated behavior or rituals that you have will ease the stress caused by the obsessions. And people who are diagnosed with OCD frequently find themselves in a loop of obsession and compulsions. If you have these behaviors, you may feel isolated because of them. This can lead to withdrawal from friends and social situations, which can increase your risk of depression. Now next we'll talk about depression with psychosis. So some individuals who have been diagnosed with major depression may also have symptoms of another mental disorder called psychosis. When the two conditions occur together, it is known as depressive psychosis. Depressive psychosis causes people to see, hear, believe, or smell things that are not real, that don't exist in reality. People with the condition may also experience a feeling of sadness, hopelessness, and irritability. The combination of two conditions is particularly dangerous. That's because someone with depressive psychosis may experience delusions that cause them to have thoughts of suicides. Talk about it. So, pregnancy is often an exciting time for the people. However, it can be still common for the pregnant women to experience depression. And some of the depression symptoms during pregnancy include: first, changes in appetite or eating habits; second, feeling hopeless; third, anxiety; fourth, losing interest in activities and things you previously enjoyed. And the next one is persistent sadness. Next, troubles concentrating or remembering. Next, sleep problems including insomnia and sleeping too much. And the last one is thought of suicide and death. So these are some symptoms which you can experience. Now the last one, depression and alcohol. So some researches has established a link between alcohol use and depression. People who have depression are more likely to misuse alcohol. Drinking alcohol frequently can make symptoms of depression worse. And people who have depression are more likely to misuse alcohol or become dependent on it. Now next we'll talk about what are the investigations that you can perform if you are suffering from depression. So basically here we are talking about what are the tests which you can perform in order to diagnose if you are having depression or not. So let's talk about the depression test now. So basically there is not a single test to diagnose depression, but your healthcare provider can make a diagnosis based on your symptoms and a psychological evaluation. In most cases, they will ask a series of questions about your moods, appetite, sleep patterns, activity level, and thoughts. Because depression can be linked to other health problems, your healthcare provider may also conduct a physical examination and order blood work. Sometimes thyroid problems or vitamin D deficiency can trigger symptoms of depression. And if your mood doesn't improve or gets worse, seek medical help. Depression is a serious mental health illness with the potential of complications. If it left untreated, complications can include weight gain or loss, physical pain, substance use problems, panic attacks, social isolation, thoughts of suicide, and self-harm. So this was all about the investigation. So that's all in this video. We have discussed about everything one should know about depression. That what exactly means depression? What are the signs and symptoms of depression? And what are the main causes that are behind that leads to depression basically? And after that, very important, what are the various types of depression? And lastly, we have discussed about the diagnostic criteria, that is, what are the investigations that you can perform if you are suffering from depression. So that's all. See you guys in our next video with the management of depression, that how you can manage this mood disorder problem, so-called depression, by using. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe, stay healthy, and stay tension free. And perform yogas, pranayams, exercises, and meditation daily at least for 3 hours. And yes, thanks for watching our video.